give you guys a minute. Do we have any online questions?
First question for Mr. Snee. Can a pre-assigned application number for a CBER IND be obtained through the portal? If not, are there any plans to expand the portal offerings to include CBER applications?
So the short answer is not right now. It's only assigning for CDER. But yes, there's a talk how we can collaborate and integrate the CBER need in the future. But the leaderships are discussing how we can make this key capability available to CBER as well.
Thank you. And another question for you. Are there plans to roll out training videos or self-training tools to assist users with various portal activities and how to perform various submissions?
Absolutely. As I referred earlier, the CDER Next Gen portal has about 20 plus products. Each product has its own video as well as self-help materials. We solicit your feedback. Let us know how that is helpful, but we continue to have those materials available on the product line area.
Do we have any questions in the room? Somebody must have a question. Yes?
So I'm new to the whole ECTD, EINDs. I'm from the University of California, San Diego. I have submitted both an electronic IND for CDER and CBER, but through the ECG portal. So should I have been using this next gen for the CDER only? Because it gave me the option on ESG.
Right, good question. So you've submitted an IND, you've sent it to CDER and also to CBER, and you used the FDA Electronic Submission Gateway, the ESG portal. Perfectly fine. Yes, absolutely. What the CDER Next Gen portal does is it offers an alternative for research INDs that are being sent to CDER. So what we found is there are some in industry who have find it, I guess, more burdensome to create an ESG account if they don't already have one, or the process to create an account can take a long time. The CDER Next Gen portal is great because you can, if you're a new user on the CDER Next Gen portal, you can have that account created the same day that you request it, and then you can send over your research IND that way. So it's an option. It's another option to make life easier, as Sayum had showed in the presentation there.
Okay, thank you.
Sure.
Do we have any questions online?
Another question for Mr. Resnick. When sending a test submission, should we use an actual package?
So I'm not sure if that's an ECTD specific question. I think it might be. So yeah, if you want to send in a sample ECTD 4.0 submission to us, then number one, we want you to go to our website, fda.gov/ECTD, where you can then find the page all about submitting samples. And that gives instructions about, what you would do, what you would include. But in short, yes, you would publish an ECTD 4.0 submission on your side, and then you'd send it in through the test ESG gateway, and then our CDER eSub team will get it and run our ECTD4 validation software on it, and then send you back an email with the results of that.
Thank you. Another question for you. If the original application submitted in version 3.2.2, can we submit subsequent sequences like deficiency responses in version 4 until the application is approved?
Not yet. So our implementation strategy at FDA is we're first just going to accept new applications and then subsequent submissions to those new applications in 4.0. But if someone already has an application in-house at FDA that's using ECTD 3.2.2, we don't foresee accepting them being able to send in 4.0 submissions until 2026 as the earliest. And we'll have plenty of communications coming out between now and then to help people prepare.
Right. Thank you. Another question for Mr. Snee. Can more than one user from a given company register for portal access?
Yes, you can register as many users as you wish.
Thank you. And you mentioned there are training tools for the portal activities. Where are the training tools located, or how can they be accessed?
So the training tools are once you logged into the CDER NextGen portal, there are product sections. For example, if you chose to build the investigational research IND application, you should be able to see it, all the trainings under the training and support module.
Are there any thoughts to bring that outside before you log in, just by any curiosity?
Not at this point, because part of it is we need to know who is logging to the portal to submit application, because it's one of the security rules out there. We need to know who we are communicating with. So with that, the logging capability is the key essential part of taking advantage of the available technology.
Any other questions in the room? Okay, it looks like we are out of time. So we will take a 10-minute break and it's 10:42. Come back at 10:52. Thank you.